Okay, so what I'm going to do is cover 4 different things. One, give you a bit of an overview of the current situation of homelessness, some stats, some figures from across the country, but also a bit of an overview about what different governments are doing, what political activity we're seeing at the moment. Then I'd like to touch on what Crisis is up to. It's quite an exciting year for us, so I'd like to tell you a little bit more about that. And then I'd like to go on, the bulk of my slot today will talk about the Homelessness Reduction Act, both how we got it and what implementation means, particularly for the health agenda. Okay, so overview of homelessness. You'll see here, this is Crisis first of all, just to give you a bit of a background. Hopefully all of you have heard of us. Most people either know Crisis either because it's a national campaigning organisation or for its services, but very few people know that actually we do both, depending on who you speak to. And I think it's a really fantastic mix of policy and practice, and it really gives us that credibility and ability to test out and innovate how to deliver services differently and evidence that and prove that to government that it works. So in a nutshell, we have 11 centres, they're called Skylight Services, across England, Scotland and Wales. Within those Skylight Services, our main components are a housing coach, an employment coach and a progression coach. And within progression, that includes mental health and physical health support. So there are 3 main pillars of support, and without those 3 elements, we don't have that wraparound support. In each local area, we do adapt to what the local needs require, but they're the 3 main components. We also have a very significant body of research behind us, so we can back up both in terms of the evaluation of our own service impact, but also national evidence base that we can build to help us develop policies. And then finally, as I said, we are one of the lead organisations on influencing government policy in England, Scotland and Wales on homelessness. We've got a very robust policy research campaigning team. So hopefully some of you in the room are campaigners as well, I'm not sure, but if not, you can always sign up after this if you're interested in what we're up to. Okay, so the problem, bit of context. You hopefully will have picked up that sadly homelessness is increasingly in the media. At the moment, we've seen a significant increase, particularly over the past 6 months, and that's naturally related to very significant increases in the trends of particularly rough sleepers across the country. But quite rightly, the media and politicians more generally and the public are much more acutely aware of the rises in homelessness, and there's quite a public demand for government to do something about that. So just before Christmas, we were on Channel 4 News. We had a live choir, and John Snow spent quite a significant amount of time on Channel 4 interviewing people with lived experience of homelessness. It was our sort of biggest Christmas year yet in terms of media coverage. It really did have a significant profile. But since that, there's been a spiral of other media headlines that have created quite a lot of public stir. So with the royal wedding being in place, I'm sure some of you might have heard about this, of Windsor Council in particular, taking what's called enforcement measures to try and remove people off the streets. So it's not the approach at all we would support. It's something that we've been quite actively publicly campaigning against, that enforcement measures alone do not work. It needs to be a package of support is the best way to help people and address their needs and support them off the street rather than apply enforcement measures. I think that controversy will continue, and it'll be really interesting to see where we go as the royal wedding approaches, because the issue keeps coming up again and again in the media. And sadly, again, we've had recent announcements or recent stories of people actually dying on the streets. It wasn't even all related to the cold weather. So the one that got a lot of media coverage was where the young man died outside Westminster. I think that really had a knock-on effect with politicians. But in reality, that happens across the country, and it doesn't get the pickup it deserves. And it's one of our sort of main messages to journalists at the moment of this is a national outcry. One person's life is a national outcry, and yet we had, I think, near 6 people sadly died on the streets during the recent extreme weather. And that's just absolutely unacceptable, and we didn't have the emergency responses really in place that should have been in place to be able to respond to that as quickly as it should have. So in terms of some numbers and settings to the context of homelessness, as I said at the start, street homelessness, so people sleeping rough on the streets, has significantly risen. It's doubled since 2010. In the past year alone in England, we've seen a 15% increase in the number of people sleeping on the streets. In Wales, the rough sleeping count has increased by 33% in the last year. So this isn't just to do with high demand housing supply issues. We're seeing increases in rough sleeping right across the country. We did our own projections research, which we've launched last year. And this is to give us an indication not only of the here and now, but what would happen 20 years down the line, 25 years down the line, if we still don't act. And we've identified that if we remain status quo and carry on doing what we're currently doing, we will have increases of up to 40,000 people sleeping on the streets. So that's significantly more than what government currently measures. At the moment in England, official statistics show that just over 4,500 people are sleeping on the streets in England on any given night. That's a huge increase since 2010. But our own projections research show it's much more likely for England to be around the 8,000 figure. So there's many that are sleeping on the streets or hidden away, sofa surfing, or not being picked up by local authorities that aren't actually being counted in those official figures. The other challenge is only about 13% of local authorities actually go out and count the number of people sleeping on the streets. The majority, the rest, use estimates to predict how many are sleeping on the streets. And it's a self-defeating objective, because if we don't have a true picture of actual demand, we can't apply the adequate resources and political will to address that need. So it's really important that we have a much more accurate understanding of how many people are actually sleeping on the streets every night. The projections research shows, you'll see in this, there is initially a slight levelling in terms of projections over the next 3 to 5 years. And that's predicted partly due to potentials of Brexit, but more generally just housing market conditions are starting to stabilise a little bit, both in terms of access and supply, but also affordability. However, we see the sharp increases at a later stage coming up by significant rises in the use of unsuitable temporary accommodation. So even though we are potentially predicting people moving off the streets, they're moving into temporary accommodation, so they're not out of homelessness, but also the nature of that accommodation is extremely unsuitable. So they're called, what we say, a life of limbo. They're not on the streets, but they're not living in the way that they want to live, and quite often that means that people will end up back on the streets because the situation isn't particularly better. Okay, so within the projections research, we also tested out some policy drivers to have a better understanding and start to hold government departments a bit more to account, and having a bit of an evidence base of what would we do if we didn't keep the status quo with our policy agenda, but we started to alter or undo some of the changes that we've seen. The one that comes out on top is stopping further welfare cuts. That would reduce the overall projections by up to 47% by 2041. So that came out as the highest. It's really important to distinguish between welfare cuts and welfare reforms, and they're two different things. And I think, and we're guilty of doing this, we're guilty of doing this ourselves, but welfare reform is not the same as welfare cut. We need to invest in the welfare system in order to meet demand. And at the moment, there's a merging between those two agendas, and quite often what is in fact a welfare cut gets hidden as welfare reform narrative. And they are two very different things. Overall, we're supportive of the direction of welfare reform, but we need to invest in a system that covers the cost of people's housings and provides adequate support to meet their needs. In terms of 60% of increase in private and social housing, again, have second highest impact, or third highest impact, should be the other way around, and we saw a decrease of about 35%. So housing supply is important and critical, but what we found is the lack of financial support through the benefit system reduces people's access, and particularly if you have experience of homelessness, it's hardest to access the housing market. So you may increase supply, but we're not actually addressing those on the lowest incomes and with the history of homelessness access problems. Maximum prevention activity. This came out second on top. We'd see a 40% reduction by 2041. And that's effectively about how do we redesign our services from one that is crisis-led to one that is prevention-led. And that doesn't just sit within the core homeless provision within local authorities. That's about how do we engage all public agencies, which is what I'm going to go on to when we talk about the health agenda. And then the final one is rebalancing the economy across regions. So again, this is about effectively looking at what our industrial strategy is and what our housing strategy is. And at the moment, we design one very separate from the other. And what we need to start to do is think about generating greater income, sort of net contributors within high deprived areas. But what you find when we start to increase labour market activity in areas of high deprivation, there isn't actually that much of a housing problem there. The problem is more quality rather than access. What we also need to do is think about increasing housing products within high demand areas where there are good quality employment opportunities. So it's not as simple as it appears, but we need to bring the two of them together. Okay, health and homelessness. I'm going to give you a quick overview because I really want to get on to the Reduction Act. Some of you will be familiar with this already, but the numbers are still stark and shocking, actually. So it's just important to take a second to remember that the average age of death for a homeless person is 47, and it's 43 for a woman, compared to 77 for the general population. So significantly lower. There are very, very clear intrinsic links between the health and homelessness agenda. 86% of homeless people report having a mental health condition. 73% of homeless people report having physical health problems. And according to the Homeless Link Needs Audit Assessment in 2015, they found that 29% of people leaving hospital were not given suitable discharge to address their housing and health needs. So there's a real missed opportunity within that window of access and trying to refer them through to sustain and stabilise housing situations. And homeless people are around 4 times more homeless people use around 4 times more acute hospital services than the general population. And when we did some prevention costings, cost-benefit analysis behind the legislation, we found that came up to around 85 million a year. So it's not only practical from the individual's perspective, but from the taxpayer's perspective. Okay, quick overview of the government's current response. As I said at the start, we've seen a lot of political activity. The Conservatives have manifesto commitment that has been enshrined in the budget in December last year to ensure that they end homelessness by they committed to ending rough sleeping by 2027 and to halve it within this Parliament, so by 2022. So that's not looking at overall homelessness, but it's about getting people off the streets, so to end street homelessness by 2027. There is a task force that has been set up, which is much more advanced than anything we've ever had before. So we have 5 Secretary of States and 2 health ministers, including Jeremy, the Health Secretary of State. So we do have the traction from a much higher level than we ever had it before. It's chaired by David Liddington, which is the PM's #1, which again originally was meant to be Sajid Javis, which would have put it under the traditional MHCLG agenda, but it's constructive and positive that it's actually been moved to the Cabinet Office to chair that, so it has gained political weight. We also have had a Labour Party commitment in the same vein to end rough sleeping. So we lobbied for this during general election, and Labour have recently announced that they would provide 8,000 homes when they became available to people. They would open those 8,000 homes up to people with experience of rough sleeping, so giving them actual accommodation to sit behind that commitment to end rough sleeping. In Scotland, we have a rough sleeping action group, which is where John is at the moment. John is chairing the action group for Nicola Sturgeon. It's looking at several different things, including ending rough sleeping, ending the need for unsuitable temporary accommodation, and having a more effective emergency response in place. So there's almost this healthy competition between governments at the moment around how to tackle and end rough sleeping quickly. In Wales, they've set up a rough sleeping action plan between 2018 and 2020, and that will include a review of priority need, which is really quite radical for them. So they've introduced a new prevention legislation but Wales are now looking at scrapping priority need like they did in Scotland 10 years before. They'll also look at how to roll out Housing First across Wales, which is the first government commitment we've had at that national level before. In England, there was an announcement in the budget in December to pilot Housing First across 3 devolved regions, which I'm sure Peter's going to touch on this, so I won't go into too much detail, but that's in Liverpool City region, Greater Manchester and the West Midlands. So it's the biggest, effectively, pilot we've had on Housing First in the UK. However, it still is a large pilot, and our line on that really is calling on government. We know Housing First works for people with chronic rough sleeping needs. We just need to roll this out across the country. We don't need to pilot anymore. Peter may correct me on that if you're finding some difficulties in the early days of delivery. Okay. So I've gone through all of those, captured that one. A little bit about what Crisis is up to. So it's our 50th anniversary this year. We 50 years old. We had discussions and we decided not to celebrate it, but instead to mark it, with the intention of we really shouldn't be around 50 years after both founders set it up, and it's a national disgrace that in a country like ours that we still have people sleeping on the streets. So what we decided to do was to mark the year and use the momentum and political will and public support that we will generate to come up with a plan to end homelessness for good. And that's exactly what we've been doing. So our plan will focus on 3 different themes: prevention, rapid response for people with low-level needs, and sustained support for people with complex needs. And that's effectively looking at how do we shift the dial to have greater public policy and service provision around prevention activity. But for those that do fall through the net and do end up homeless, how do we effectively have an emergency response to deal with it immediately? So how do we move people that have low-level needs back into accommodation as quickly as possible so that their support needs do not escalate and they become rough sleepers? And for those that have more chronic rough sleeping needs, how do we provide instant, sustained support for them so we move them immediately off the street and provide a much more integrated package of support to meet their needs? And that's predominantly looking at Housing First. How do we provide a model of identification and referral into a Housing First model as quickly as possible? So they're the 3 themes. We run this across all different policy areas. So we have a big policy grid that covers welfare, housing, justice, health, LGBT, young people, older people, every policy theme you can think of. So it really is quite a big overarching plan. We developed it in collaboration with people that have been homeless, as well as frontline organisations and policy experts. So we've, over the past 6 months, we ran a national consultation across England, Scotland and Wales, reached about 1,000 people. 300 of them had lived experience of homelessness. Okay, been told to hurry. So we will, I'm not going to go into details, but we will be publishing that plan on the 11th of June 2018, and we will have, that's our national conference, so happy to circulate details of that if you want to see the content. The Homelessness Reduction Act. Very quick bit of background. We've been on this panel before talking about the campaign, so I won't go into detail. But in effect, we've had a turned away campaign set up for quite some time based on some mystery shopping that we did, where we went in and people who had lived experience of homelessness went in and mystery shopped local authorities about could they access health if they didn't fall under, or access homelessness support if they didn't fall under priority need. And we found that the majority of people were turned away from the council with little or no help whatsoever. And the nature of the support was a very hostile environment and not very personal. So that led us on to campaigning for change. So over the past 2.5 years, we set up an independent panel and to shift the dial from we need the legislative change to actually what is the legislative change we're after. So we brought together experts from different sectors to come up with our own legislative model, and we based that on England and in Wales and Scottish legislation. So we pulled out the bits that would work best for England based on the current context. We launched that and then made a proposal to the MP Bob Blackman, who was a backbench Conservative MP that sat on the Communities and Local Government Select Committee. He agreed to take on our proposed model through a private members bill. And in a nutshell, this really simplifies it, but we had about just under a year of exceptionally intense campaigning and lobbying, and worked with politicians from all political parties and across the CLG Select Committee to gain cross-party support, and managed to get the piece of legislation passed in May last year. So that included a financial commitment from the Minister of initially 61 million, and that went up to 72 million for the new duties. However, that money is to be reviewed within a 2-year period. So it's not the amount of money we would expect to underpin significantly new duties as such. However, there is a review date in process. Implementation will begin very soon. So I think it's the 2nd or 3rd of April this year. And we've updated the statutory code of guidance that sits behind that, and that was published last month. In a nutshell, what the legislation does, it introduces new duties. So there's 3 new duties. The basis behind that duty is to open up access and support and advice for anyone that is at risk of homelessness or is currently homeless. So it introduces an entirely new legal duty on all local authorities to actively try and prevent people from becoming homeless for up to 56 days before they're at risk of becoming homeless. Introduce a new relief duty. So this was a little bit of a compromise from the concept of getting rid of priority need altogether. We looked at that, and similar to what Scotland did, and realised that wouldn't be feasible in England. We're not there yet. What we need to do is increase our prevention activity to reduce the flow for those that become homeless before we start to open up the nature of support people receive. So relief duty is aimed at people that don't fall under priority need but have become homeless, and it will require local authorities to provide support to help people navigate their way back into accommodation. So what it won't do is require local authorities to house them in temporary or permanent accommodation, but it's support to navigate the system. There's measures to incentivise cooperation. So this is something that the department felt quite strongly about, of how do we use this transformation to try and have more of a sense of ownership from people using the service. Historically, it was very much a sort of gatekeeping process, and people had to ask for support and jump through hoops. And the turnaround around cooperation is meant to be much more about, we're here to help you, and use a coaching model, but encourage people with experience of homelessness to try and help themselves as much as possible as well. The duty to refer, I think, is the most transformative one in all of the bits of legislation, and that's effectively about placing a duty on a number of public agencies to identify people that are at risk of homelessness or are currently experiencing homelessness and refer them through to the housing options teams within the local authorities. It was, when we had it in the legislation, a duty to cooperate, and there was support from number 10 for duty to cooperate. However, because it was a private members bill, we only had a certain amount of time to get it through. We didn't know what a duty to cooperate would mean for the relevant government departments, so we couldn't have got Secretary of State sign-off for cooperation, so it got bumped down to a duty to refer. However, in the legislation, there is discretion for the Secretary of State to put that up to a duty to cooperate at a later stage, once we have the Act implemented and we have a better understanding of what that means. Okay, so the duty to refer, and this is the bit I think the real takeaway for everyone in the room to think about what it means in relation to the health agenda. So under the duty to refer, and including probation and job centre and other public agencies, it also specifically lists under health A&E, urgent treatment centres and hospitals providing inpatient treatment. So they're the main agencies that will now be required, as of October this year, will be required to identify and refer people with experience of homelessness or at risk of becoming homeless through to the local authority, the Housing Options Agency. There's real benefits behind this. So I've been doing a bit of a roadshow over the past couple of days. I was doing a DWP day yesterday, and I'm doing a health day today about what are the opportunities actually for different government departments to achieve what has always been the holy grail of how we integrate service provision to act earlier and more effectively and provide that package of tailored support to meet individual need. And we all know it needs to happen, but it's been exceptionally difficult to achieve in so many public service areas. So the duty provides a real opportunity for us to start to think about how do we integrate those services and align our provision, both in terms of funding, in terms of assessment, in terms of management, in terms of measuring outcomes. We can do lots of learning from the homelessness prevention trailblazers, which I'm sure, again, we're going to hear about. I know that from Steve in particular, we've been doing a lot of work with the trailblazers around how do we test out what prevention upstream could look like. So the next steps for us really, as I said, start when we were pushing the legislation, we did have it down as a duty to cooperate. I would say that should still be the ambition. Because there's a duty to refer there does not mean that we shouldn't be aspiring to try and achieve a duty to cooperate. In reality, we know that homelessness is the failure of other public services further upstream. You know, poverty is the most acute, or homelessness is the most acute form of poverty. When people experience poverty and it goes wrong even further, they become homeless. So the ambition behind this is how can we shift the housing and homelessness agenda further upstream so it becomes an integral part of health, it becomes an integral part of employment, it becomes an integral part of probation, so that other government departments start to see the importance of stabilising people's accommodation as critical to help them achieve their own departmental objectives. And that's really the transformative shift that would underpin a duty to cooperate, as opposed to what we will see at the moment is a duty to refer. And whilst duty refer is great because it will bring those agencies together, what it will simply do is refer a significant volume of people through to local authorities that are already struggling to cope with demand. So it's really important we try to shift the other way around and increase our prevention activity and decrease our crisis activity. And I think this is the last slide. Looking ahead, these are the key challenges really around the implementation of the Homelessness Reduction Act. It's come in quite quickly. There have been trailblazers that we will hear about. There is a shortage of funding behind the duties, and we have recognised that. The challenge to make the case for additional funding is data. We've never had data around the volume or the intensity of support needs for those that come under prevention or the relief duty. So it's very difficult for us to make a case of this is how much it will actually cost. Because there will be new duties in place during the review period, we will for the first time have some data that we can start to record. But it's really important that we capture that data from different sources, so not just from the local authority teams, from other public agencies, including health. Other big challenges really are about affordability, the housing market as a whole. There's so much we can do to provide the public service provision, but if the housing stock isn't suitable or accessible, it's really challenging to move people out of homelessness for good. And supporting people with complex needs. I think that sits outside to agree the Homelessness Reduction Act. It's related to the work that the task force is doing around Housing First in particular. And our big agenda will be to bring together the transformation that we see through the Homelessness Reduction Act with the transformation that should come from the commitment to end rough sleeping. And that's me.